I'm Victor Valcour. I'm the Executive Director for the Global Brain Health Institute and the Atlantic Fellows for Equity in Brain Health, as well as Professor at the University of California, San Francisco. If you'd like to learn more about our institute or the play, watch this video. The Global Brain Health Institute started in 2015 to enroll fellows. We began thinking about it back in 2013, maybe even before that. The idea is that across the world, dementia is a grand challenge. It is increasing in frequency around the world, largely in low middle income countries because these countries have aging populations. And dementia is one of the most costly diseases in the world. It costs in the United States more than the total cost of cancer, heart disease, and stroke combined. And a lot of the costs are informal costs, so they're taken up by caregivers, families. Oftentimes people have to give up their jobs to caregive for families, and oftentimes the people giving up their jobs are women. Just one of the many inequities in dementia care. The inequity in the fact that much of the increased prevalence of dementia will be in low middle income countries that may not have economies to support these costs. Also the inequities in the disease itself, which seems to be more frequent in women. And then the inequities of care. We haven't even started with the determinants of a healthy brain, and the social determinants of a healthy brain are linked to disparity. So we really are an equity program, and that's why our core training program is called the Atlantic Fellows for Equity in Brain Health. And the Atlantic Fellows for Equity in Brain Health, now we have over 140 fellows from more than 40 countries that spend time with us, using an equity lens to understand dementia and how we can approach this grand challenge. But it's to promote health for aging populations around the world. And I think we're a global program and we're an interdisciplinary program. And as I said, we're an equity program. So our primary goal is to train the next generation of leaders to address this grand challenge worldwide. We hope to train as many as 600 leaders around the world to address the issue of brain health, and particularly in communities that are underserved, otherwise don't have access to care, to address major challenges in those areas. To date, 140 fellows in over 40 countries is quite an achievement. Each of the fellows spends a year with us, and as I've mentioned before, they come from every discipline you could imagine. And this is why the arts are so critical to us. We have artists that come into our program, and they are absolutely critical, not only in therapeutic sense, but in advocacy and awareness. Our partnerships, for example, with the San Francisco Conservative Music increases our stage of awareness of diseases. And plays like UnRavelled increase awareness of these diseases that affect the brain in a way that we capture audiences that we otherwise wouldn't be able to. To be able to firmly address this grand challenge, we need everybody. Anybody with zeal, anyone with energy, anybody who is trying to address this issue from whatever lens, whatever approach they're coming from, to come together and create a community that is working collaboratively. The Helmand Visiting Artist Program has been around in the Memory and Aging Center for many years. This has been an incredible opportunity to bring artists into the space of our Memory and Aging Center. The Memory and Aging Center is a leading center for clinical care, education, and research in the United States. And by bringing in artists, we do many different things. It helps us to think better about our research. It helps us to think better about our education approaches, and certainly has helped us with understanding the lived experience of dementia and the work that has been done. But I also think it's nurtured us as investigators and as clinicians, brings us together with common themes, and nurtures, keeps us healthy ourselves. This is a brainchild of my boss, Dr. Bruce Miller, who has always had a lens of bringing in the arts into the work that he's done. Since the day I joined the Memory and Aging Center 15 years ago, this has been part of his narrative. It's also quite instrumental in how it formulated our approach to the Global Brain Health Institute, which sits in the Memory and Aging Center. I credit to a large degree the multidisciplinary approach that we're taking to brain health protection strategies, to the experiences that I've had particularly with the Helmand Visiting Artist Program, but through the values that Dr. Bruce Miller has held and brought to the programs at the Memory and Aging Center. I know a little bit about the relationship with Jake Broder and Dr. Bruce Miller, but I'm certainly not an expert on this. The content of the play has been around for a long time. Dr. Bill Seeley and Bruce Miller published a paper in this space. I think around 2005, I had read that paper as an early faculty member at the Memory and Aging Center. And it essentially talks about the story of this play, an individual whose art changed substantially in the setting of a neurodegenerative syndrome. And what's really very exciting about it, I don't know if I probably shouldn't give the punchline away. You need to come and watch the play because there's a twist that connects this patient and the art that she creates that is just unmatched and almost gives you goosebumps thinking about it. We have leveraged this story for a large event in San Francisco, and I think Jake Broder had become interested in it before that and really wanted to bring this to the stage. And I think part because of the exciting story that underlies it. To us, it really highlights the emergence of creativity in the setting of neurodegenerative disorders, and is a really strong advocacy platform for us to raise awareness of these neurodegenerative disorders. It's important that this program be seen online for a large audience because it will help us to raise awareness with larger audiences than we can get into one performance, and certainly magnitudes of cost saving and scaling that are possible. So I am particularly excited about this and our ability to share it worldwide. One of the showings will be in connection with an international conference on dementias, and I hope that will bring in a large international audience. The added benefit there as well is an opportunity for the Global Brain Health Institute to lead in the narrative that arts are critically important in our mission to protect the world's aging populations from threats to brain health. That's critical for us, that we lead and show by example how important it is to work with all groups of people to advance our mission of protecting the world's aging population from threats to brain health. Well, I think the audience will certainly get an incredible entertainment opportunity. The storyline is one that has twists and turns, and as I mentioned before, almost gives me goosebumps thinking about how this all comes together. I understand that the actors are phenomenal, so I'm absolutely certain the performance will be amazing. I also think that the people who watch the event will learn a little bit about specific neurodegenerative syndromes, that dementia can present in many different ways, not solely with loss of memory, but can present with behavioral changes, can present with language changes. So that degree of awareness, I think, will be very important for people to get out of it. And as I mentioned before, I think the intersection between science and the entertainment of this opportunity is also critically important in terms of a mechanism, a narrative in which we can increase awareness broadly, working together collaboratively across silos, not within our silos. We've accompanied each of the nights with a little discussion with some of the experts in neurodegenerative disorders. This will be a really great opportunity for people to understand a little bit of the science behind the disease that is presented. It's really a novel opportunity, and it again is a pattern that we want to create more and more. We would love to partner with more artists in which we could fold in various aspects of neuroscience to increase awareness around science, increase awareness around dementia, particularly around early signs and symptoms of dementia, so that people understand and seek support and help earlier on in disease. One large challenge we have is that many people with dementia do not seek treatment for a long time, thinking it may instead be some behavioral or psychiatric illness rather than a neurodegenerative syndrome. So I think this will be another opportunity to speak to the experts about these concepts and maybe increase the awareness around the early symptoms of disease and the need to seek support and care. People should watch this play to learn a little bit about a neurodegenerative syndrome and also to be entertained by a really fascinating story, to learn a little bit about the possibility of emergence of creativity in the setting of neurodegenerative disorders. There are many compelling reasons to watch this. I'm particularly excited to see the quality of the performance, which I'm absolutely certain will be outstanding, and the entertainment value of this will be incredibly high, and at the same time, an educational opportunity. Local community theaters and hospitals being together as a needed contributions to our communities. It's an interesting mashup. We've certainly seen recently with the COVID epidemic how critically important it's been to have outstanding hospital systems in our community. And particularly here at the University of California, San Francisco, we've been incredibly fortunate to have some of the brightest minds addressing this huge challenge. And I think the community services is really quite amazing. The arts are just as critical to a healthy society, to a healthy community, to be able to elevate narratives and to bring people together in a way that is inspiring and collaborative. I think both. It's interesting to see the mashup in your question of including both the hospital systems and local theaters, and they're both critically important for, in some ways, many of the same reasons, nurturing a healthy society. The Global Brain Health Institute is located both in the University of California, San Francisco, and in Trinity College in Dublin. This partnership of two founding sites supports the training of international fellows, Atlantic fellows, from every discipline that you can imagine, including arts, anthropology, nursing, clinical care, like neurologists, geriatricians, neuroscientists, and entrepreneurs of different types. We bring people together every year, about 40 at the two sites, and they spend a year together trying to create a network and a community. And I like to think of it as a think tank where they learn and think with each other about the challenges in their community. And by learning across disciplines and across regions, novel ideas are bound to come up. We champion our Atlantic Fellows to achieve change in their community, which I think is a novel way of addressing a global challenge. Instead of coming up with the solutions, we don't do that. We create a lot of content and opportunities for them to create solutions that will work culturally within the communities that they work in. And this is a really strong piece of what we are at the Global Brain Health Institute. I'm Victor Valcour. I'm the Executive Director for the Global Brain Health Institute and a professor at the University of California in San Francisco. If you've enjoyed this discussion and want to learn more about our institute or the play, join us. This premier event occurring online and open to all.